Newborn reflexes are your baby's involuntary muscle responses to stimulation. Certain actions or sensations produce specific muscle reactions. That mean your baby isn't controlling the responses. They are happening automatically without your baby trying. So infant is the term used for a baby under 1 year of age. The term infant usually refers to a baby from birth to around 1 year of age. You may also use the term baby during this time. And what is a fetus? A fetus is an unborn offspring that develops and grows inside the uterus of humans and other mammals. In humans, the fetal period begins at 9 weeks after fertilization of an egg by a sperm and ends at birth of the fetus. So, brief summary of previous class. So, in part 3 of our lecture series, we understood the concepts of initial care of the newborn. Then we talked about newborn screening tests and prophylactic measures taken for several diseases. Then we talked about head to toe physical examination of the newborn. Yeah, we went into extensive details of how to examine the baby. I shared almost all of the knowledge that I could, remaining within the bounds of this lecture. I couldn't go into the specific details of every body system, but as deep as I could go, I shared all of the details of how a physical examination of the newborn is done, being a healthcare professional. Care taken during first few days after birth, then feeding of the newborns and infants. We discussed the feeding methods and breastfeeding methodology and proper ways to feed the baby, then dealing with common neonatal problems. We discussed the common neonatal problems, that these common neonatal problems we couldn't cover all of them, and we will continue to discuss common neonatal problems in today's lecture as well. So, taking care of the newborn and infant continued. In this section, we will continue to discuss all the details regarding immediate and delayed care of the newborn and infant. So basically, as this topic is very extensive, I try to cover it in one class, but it would have been injustice with the topic to cover it in one class, as this topic is very, very, very important. That's why I decided to make second part of this newborn care. So as a whole, this is fourth lecture of our lecture series, Maternal and Child Health. So, some common neonatal problems continued. So, cradle cap is the common name for seborrheic dermatitis. So, it's basically an allergic type of dermatitis mixed with some fungal infection of scalp as well. It is a yellowish, patchy, scaly, and crusty skin rash that occurs on the scalp of recently born babies. It is generally managed by application of coconut oil over the affected part of scalp at night, followed by shampoo with cetrimide or catavolon. If not relieved gradually, dermatology consult should be consulted. So basically, dermatologist should be consulted if it does not settles on its own, but usually it does settles on its own. Even in our country, people use coconut oil along with yogurt, and the baby's dermatitis of the scalp or seborrheic dermatitis settles within a few days of use of coconut oil and yogurt. So it's a self-limiting disease in more than 90% of the cases. But if it is still not resolving even after homemade remedies, then you need to consult a dermatology guy. Then obstructive nasolacrimal duct, it is a common problem related to the eyes of the babies. So it is characterized by persistent tearing from one or both eyes without presence of any congestion or infection. It may be due to congenital obstruction of the nasolacrimal duct, which usually opens by 3 to 4 months of age in the affected babies. Gentle massage should be done over the tear passage from above downwards with inward pressure on the lacrimal sac for about 15 to 20 times per day. So basically, there is the anatomy of the nasolacrimal duct. So tear gland is present on the superior lateral aspect of our eye. This tear gland produces tears, and these tears flow down across the surface of our eye, and then they pass through the puncta. Punctas are openings on the medial side of our eyes, the medial epicanthal folds of the eyes. One puncta is on the superior aspect, and one puncta is on the inferior aspect. One puncta is on superior eyelid, and one puncta is on inferior eyelid. And these punctas then open into canaliculi. These canaliculi then are two in number, one from superior eyelid and one from inferior eyelid, and then they join afterwards, and they drain themselves into the tear duct. That's why whenever we cry, the tears start draining from our nose, and we have to clean our nose repeatedly when we are crying, because the tearing process produces excessive amount of watery fluid, which are our tears. So some of our tears go directly out from our eyes, but then some of our tears get drained through these canaliculi and they come into our nose. That is why our nose starts watering whenever we are crying. So as babies, tear production is a relatively higher than adults. So if their nasolacrimal duct is blocked, then their eyes keep secreting the tears all the time. So you have to do the gentle massages of the nasolacrimal duct, and more than 80% of the cases, or even 90% of the cases, resolve on their own within 3 to 4 months of age with these massages. And if they do not resolve, then you need ophthalmology consult. You need to consult the eye specialist. Then there is a condition called mastitis neonatorum. The enlargement of breasts occur in full-term babies of both sexes on third or fourth day due to sudden withdrawal of maternal hormones, and may last for a few days or even weeks. No management is needed. The condition recovers spontaneously by 2 to 3 weeks. The local massage fomentation should be avoided. So this is not a life-threatening condition. This is not some condition which needs treatment. You just care that nobody touches the chest of the baby hard. Nobody applies any kind of pressure, or no hard object touches it, because it may be painful for the baby. But apart from that, the baby's chest inflammation usually settles on its own within a few days. Then vaginal bleeding. Vaginal bleeding is a feature that creates problem in female newborns. So the development of menstrual-like withdrawal bleeding may occur in one-fourth of the female babies after 3 to 5 days of birth. It may be due to withdrawal of maternal hormones. The bleeding is mild and last for 2 to 4 days. The local aseptic cleaning of the genitals is advised, so you need not to worry about it. Many of the female kids and female newborns, parents come running back to the hospital that our baby is bleeding parvaginally. What happened to our baby? This and that. But in case of female babies, it is normal after 3 to 5 days of birth to shed some blood paravaginally from the uterus due to withdrawal of the hormones of the mother. So there is a condition which then affects the male genitalia, and that is called phimosis. So phimosis is non-retraction of profuse skin. It is normally seen in neonates due to adhesions between profuse and glans penis. It is termed pathologic when non-retractability is associated with local or urinary complaints attributed to the phimotic profuse. If the problem persists, circumcision should be done by a qualified healthcare professional, preferably some surgeon, as soon as possible. So, phimosis is basically, as we already know, if a baby is an uncircumcised baby, then there is foreskin of the penis that covers the profuse, that covers the glans penis all the time. So, if that foreskin sticks to the glans penis and does not go back on the penile shaft, shaft is the area of the penis behind the glans. Shaft is the basically lengthy part of the penis when a penis is erect. So if a foreskin or profuse does not go back behind glands, then that can create problem, especially local or urinary complaints start to appear. There is some sort of urinary retention in the baby, or there is some sort of infection going on. Then you need to get the circumcision done, because these kind of problems then may sometimes make these type of problems can be painful for the baby as well in the long run. Then there's a problem. It's not a problem. Basically, it is a rash. Erythema toxicum. It is erythematous rash with central pallor appearing on the second or third day in term babies. The rash starts on the face and spreads to the trunk and extremities in about 24 hours. Exact cause is unknown, but it may be due to irritation of vernix caseosa. It disappears spontaneously after 2 to 3 days without any specific treatment needed. So if it persists even after 5 days, then you need to get the dermatology consult. But if it is present and for 2 to 3 days, you need not to worry about it, because it usually settles down after 3 days. Needle teeth, now that is a problem which needs handling with care. The eruption of one or more lower incisor teeth before or soon after birth is seen in 1 in 4,000 babies. The teeth may become loose and interfere with breastfeeding. There is a risk of spontaneous dislodgement with aspiration of the teeth as well, which may create respiratory problems. Therefore, it is advised to get the natal teeth extracted by dentists who have experience in neonatal dentistry. So these teeth can be dangerous for the baby, because they may get erupted or they may get dislodged and cause the airway to get blocked. And they may also interfere with the teeth, feeding of the baby, and they may also be a painful stimulus for the mother who is breastfeeding the baby. Therefore, it is advised to get the needle teeth extracted. Then there is a problem which many of the babies suffer from, and that problem is called tongue tie. So the medical terminology for it is ankyloglossia. Glossia is basically for the word tongue. So tongue ties, it may be either in the form of thin, broad membrane or thick, fibrous frenulum under the tongue with a notch at the tip of the tongue due to traction. Tongue tie interferes with sucking or delay the development of speech. Yeah, those kids who have severe cases of tongue tie, they cannot utter the words clearly, and their speech development gets delayed. The genuine tongue tie may be snipped after 3 months of age after pediatric surgery and ENT consultation. Yeah, short lingual frenulum restricts tongue movement, so tongue is unable to move freely throughout the oral cavity, and it in the long run it interferes with the sucking of the milk, and it also interferes with the development of speech. Babies are not able to utter some of the words clearly, and they have difficulty in learning or speaking languages. Therefore, tongue tie needs treatment, and it needs to be snipped, and it can be snipped after 3 months of age after pediatric surgery consult and ENT consultation. Subconjunctival hemorrhages. So all of these problems that I am sharing with you, these are commonest problems. There are some rare problems as well, but these are the commonest problems which we encounter. Some of these problems we already discussed in our previous class. That is why I'm not going into details of vomiting, diarrhea, or constipation, because I already discussed vomiting, diarrhea, constipation, excessive sleepiness, insomnia, etc. in previous in at the end in the end section of our previous class. But these are also the problems which are commonest, and these are the problems which create too much worry or too much frustration in the new parents. That is why I'm sharing these problems, because if you are attending my lecture, then you should know some common neonatal problems, as these are part of the routine newborn care. So subconjunctival hemorrhages, semilunar arc. Semilunar means uh, uh, somewhat like moon shaped arcs of subconjunctival hemorrhages located at the other canthus is a common finding in normal babies. The blood gets resorbed after a few days without leaving any kind of pigmentation in the eye. So white conjunctiva remains white conjunctiva even after blood gets resorbed. So there is no problem afterwards. It is a self-limiting problem with no intervention needed. Yeah, many of the times the parents rush back to the hospitals when they see that there is blood in the eyes, there is blood mixed in the whiteness of the eye, and what should be done, and what happened with our baby, and this and that. But these are common problems, especially during vaginal deliveries when there is too much pressure on the face of the baby. Some of the blood vessels inside the conjunctiva of the eye of the baby get erupted, and the blood extravasates beneath the subconjunctiva, beneath the bulbar conjunctiva. Bulbar conjunctiva is white of the eye. So some of the blood gets distributed beneath the bulbar conjunctiva, and it appears red in color as it is blood, but it gets resorbed spontaneously. You need not to do anything, and you just need to reassure the parents that this is a normal phase of life. Then there's a problem called umbilical hernia. When the cord is fallen off, umbilical hernia may manifest after the age of 2 weeks or later due to weakness or faulty closure of the umbilical ring. Application of coin and bandage over the hernia is not recommended as it may further weaken the anterior abdominal wall. Most umbilical hernias, yeah, most of them, most umbilical hernias in babies close on their own by the age of 1 or 2. So you need not to do anything till the baby is 2 years of age. So you have to wait until and unless it is a very large umbilical hernia. You need to wait for it. If the hernia, as shown in the picture, if the hernia is of the size of a ping pong ball or smaller than that, you need to wait until the baby is 2 years of age. And most of the hernias settle on their own with the strength of the abdominal wall muscles, which closes itself on the gut. But if after 2 years of age or 1.5 years of age the hernia increases in size or it does not settle, then you need to go to the pediatric surgeons, and they treat the umbilical hernia, and they do a hernioplasty or herniorrhaphy, which is basically closure of the hernial orifice through which gut loops are coming out of the abdominal wall. So infection control in neonates and infants, because your baby may be at risk for catching colds and other infections. Always wash your hands before you hold your baby, especially after you change your baby's diaper. Always wash your hands before you nurse or your baby when you prepare your baby's formula bottle. Make sure family visitors who will touch your baby wash their hands with soap and water as well. So if a visitor comes to see your baby, allow them to see your baby if they're not suffering from flu or any kind of blisters or skin conditions or any kind of cough. Then they are allowed to visit the baby, but they should be but it should be made sure that they wash their hands with soap and water before touching the baby. Limit visitors to 2 to 3 people at a time. If anyone has a runny nose, cough, or fever, ask him or her to visit at another time. If anyone has a cold, sore, fever, blister, no kissing of the baby. Yeah. If anyone has a cold, if anyone is suffering from cough, if anyone is suffering from fever, if anyone is suffering from skin blisters, because blisters most commonly are due to human papilloma virus, and that virus spreads in the babies very, very fast. So babies have no protection against that virus as well. So if anyone is suffering from any kind of cold, any kind of cough, any kind of sore throat, any kind of fever or blisters on the skin, no kissing of the baby. They shouldn't be allowed to kiss the baby even if the person is the mother of the baby. Try not to kiss the baby on hands and feet. They are the first thing baby puts in his her mouth. Keep baby away from pets for at least first month. Well, in my clinical practice, I advise keeping baby away from pets for at least first 3 months of life, because their immunity is so weak and pets are laden with too many bacteria which are so foreign, so new for the babies. So keep baby away from pets according to my guidelines, according to my clinical practice, at least first 3 months. But as WHO says, they say you can keep away from the pets for at least first month. Yeah, but in my clinical practice, I always advise to keep the baby away from pets for at least first 3 months of life, so their immune system gets developed before they introduce themselves to some pet. Keep your baby indoors as much as possible, especially first 40 days of life. Take only necessary trips and avoid crowds. For example, church, grocery store, mall for first 2 months of life. Baby should have his her own washcloth and towel, not the one that someone else use. Yeah, baby's clothes, baby's towels, baby's washcloths should be separate from adults' washcloth or towel. Do not put something, for example, pacifier or bottle in your mouth and then in baby's mouth, because oral cavity oral cavity is full of bacteria. There are nearly more than 25 to 30 types of bacteria in our oral cavity, which are not harmful to us, but they may be pathogenic for babies. Therefore, do not put something, for example, pacifier or bottle in your mouth and then in baby's mouth, especially during first 4 to 5 months of life. You take care of these things. Then diaper care of your baby. Change your baby's diaper often. Keep the diaper area clean by washing gently with a clean washcloth using baby soap and warm water. Be sure to rinse off all the soap and allow the area to dry before putting a new diaper. For boys, lift the scrotum and wash all the skin folds carefully with warm water. If your baby is not circumcised, do not pull back the foreskin on daily basis. This is not only painful for your baby but can cause an infection as well. For girls, always wipe gently from front to back. Yeah, start from the vaginal area and go to the back, and to avoid spreading bacteria into the vaginal area. Use a clean cloth with each wipe. Use separate skin folds and wash gently with plain warm water. Remember to always wash your hands before and after changing a diaper, because you may touch the baby's face afterwards, you may touch baby's nose afterwards, you may touch baby's eyes afterwards, and the baby's poop is full of bacteria which may spread to the baby's eyes or nose. So you always wash your hands before and after changing a diaper. Care of the circumcised penis. For the first few days, the tip of the penis may be red and have yellow drainage. It is normal for post-circumcision penis. Gomco circumcision is basically a circumcision technique. So after Gomco circumcision, apply antibiotic petroleum ointment and gauze for 2 to 3 days with each diaper change to keep the diaper from sticking to the penis. Then there is plastical circumcision. The plastic ring and string usually drops off within 5 to 8 days. Keep the penis clean until healed about 7 to 10 days. Call your doctor if there is swelling or foul smelling discharge, redness that get worse after 3 days, and if there is more than a few drops of blood from the circumcision site, immediately call your doctor or go back to the hospital. Otherwise, circumcision, if done by uh, proper healthcare professional, is a very safe method, is a very convenient method, and it is not painful for the baby at all. And circumcision should be done within first 3 months of age, because as the baby grows older, the limb movement increases and the circumcision becomes painful. And as the baby is small, the smaller the baby is, the easier the post circumcision time for the mother is. So circumcision should be done within 3 months of age. It is easier for the baby, it is easier for the mother, and the healing is very fast during the first 3 months of the life. Bathing and skincare. Until the umbilical cord falls off, your baby will need a sponge bath. After the cord falls off, the baby may be given a bath in the tub. Baths may be given in a small tub or sink. A small towel may be placed in the bottom of the tub or sink to prevent slipping. Choose a timer for bathing when mother and baby both are rested. This can be an enjoyable playtime for both. Your baby does not need to be bathed every day. You may do it on alternate days. Remember that babies are very slippery when wet, especially when soapy. They're very slippery, so you handle with care. You use very firm but soft hands so that the baby does not get hurt, but you do not let the baby fall off from your hands as well. Never leave baby alone in the tub, not even for a few seconds. Never ever. Always bring everything you need for the bath to the tub before you begin. Towel, sponge, baby soap, lukewarm water, mug, whatever you need, you bring everything before you begin. Temperature of room and water should be lukewarm. Choose a location in which there are no drafts. The room should be comfortably warm. Water should be warm, not hot. You can test it with your wrist or elbow to check the temperature. Techniques for washing your baby: use plain water for washing the baby's face. This may be done first. Even after placing the baby in the tub or skin, gently wipe the eyes with a washcloth from the inner corner of the eye to the outer, then wash the rest of the face. Do not use cotton swabs, Q-tips to clean the ears. Use a washcloth. Yeah, you do not use cotton swabs. You just use a washcloth for the clearing of the ears. Wash small areas at a time. For example, one arm, then the other arm, one leg, then the other leg. You do not keep and start washing whole of the body in a single go. If giving a sponge bath, dry each area after washing. You may keep other areas covered, such as with the receiving blanket. This is applicable in colder climate areas, not for Africa or Asia, where temperatures are almost always 45 to 50 degrees Celsius. But in colder climates, you need to keep the other areas covered, and you just wash one area of the body. uh, Milk and dirt can collect in the baby's skin folds such as neck. Clean well between the creases of the folds of skin as well. Do not be afraid to wash baby's head. You may use a washcloth or baby brush on the scalp as well, so that dermatitis does not develop, fungal infection does not develop. Use thorough cleaning to prevent cradle cap. Wash the diaper area last. Wash girls' genitalia from front to back, as I have already told. Do not use a variety of soaps or lotions or variety of shampoos. You can select very specific kind of soaps or lotion which do not contain excessive irritants for the baby's skin. So I will not go into further details. And breast milk and formula milk preparation and storage. Do not use a microwave to heat formula or human milk. Yeah, you do not use a microwave oven for formula milk or human milk. Once the baby drinks out of bottle, throw the rest of the milk in the bottle away. Wash bottles and nipples in hot soapy water or in the dishwasher. Your baby does not need plain water, so you do not give plain water to the babies. It is a common practice here in Southeast Asia, in Pakistan, India, and Bangladesh. They keep giving plain water to the babies, and they think that water baby is getting dehydrated, while in reality, baby is not getting dehydrated. If you care about the baby's water intake, you just give extra amount of water to the mother, and the mother's milk will create all will clear all kind of water deficiencies in the baby as well. Ask your pediatrician first before giving your baby juice or cereal. No cow's milk until after the age of 1. Yeah, it is recommended to wait giving cow's milk until after the age of 1 year, but some pediatricians allow giving cow milks, especially in low income household settings, after 6 months of age. But keep that in mind, cow's milk does not contain any kind of iron, so babies get anemic very quick after 6 months of age who are solely on cow milk. That is why proper weaning is very, very important. If you're feeding your baby formula comes in three forms: powder, liquid, concentrated, and ready to feed. Use an iron fortified infant formula for babies less than 1 year old. Yeah, you need to give iron fortified infant formula for babies, because babies get iron deficiency anemia very quickly after 6 months of age if they are not being given proper iron rich diets in the weaning. For example, they are not being given dates, they are not being given red kidney beans, they are not being given red meat products, or they are not being given any kind of iron rich diets, for example carrots, apples, etc. So these babies are prone to get iron deficiency anemia, and it is very, very common here in Southeast Asia. Almost 80% of the babies in Southeast Asia if I'm not wrong. More than 70% in my clinical practice, more than 70% of the babies, if you get them checked for iron deficiency, they come out to be iron deficient due to these poor weaning practices. Our parents keep giving only milk to the babies until after 1 year of age, and they do not give them cereals, they do not give them fruits, they do not give them iron rich diets which are healthier for the baby, and they do not care about the baby's weaning. So the babies get very, very micronutrient deficient by the age of 1 year. Check the expiration date on the formula can. Always wash hands before mixing formula. Read and follow the direction for mixing. Concentrated liquid formula is good for 48 hours in the refrigerator after diluting. Powder formula should be used within 1 month of opening. Yeah, if you have opened a can or if you have opened a pouch, then you should use the powder formula within 1 month of opening. Refrigerate and use any unused formula within 48 hours after mixing. You throw it after 48 hours. You do not use it after 48 hours. Most city water supplies are safe. Your water comes from a well. It needs to be tested before you use it for your baby's well. If before your baby, well water may need to be boiled for 15 minutes before mixing into formula. Storage of mother's milk. Guideline for storing mother's milk at home are less strict than when your baby is in hospital. So you can store mother's milk in your refrigerators if your refrigerator is condition is good and it can maintain temperatures below 6 or 5 degrees Celsius. Then it is very, very important that when you put your babies to sleep, then there should be a safe sleep environment. So babies should be made to sleep in the same room where the parents are. Use a firm and flat sleep surface such as a mattress in a safety approved crib covered by a flat fitted sheet. So the sheet should not be loose, as the babies are prone to put sheets on their faces. The sheet should be fitted on the crib mattress. Do not put pillows, blankets, or sheepskins or crib bumpers anywhere in your baby's sleep area, as baby may put these things on your face and they may choke. Baby should not sleep in an adult bed, on a couch, or on a chair alone with you or with anyone else, because there are chances that baby may die. Yeah, babies, there are instances of babies dying just because the mother was too exhausted, and the mother slept on the face of the baby for 2 or 3 hours, and when she woke up and the baby was no more in this world. So there are some instances, and if a mother is exhausted or if she is caring alone, then it is advised as at least first 3 to 4 months of age, the mother should be sleeping at some distance from the baby but within reach of the baby. Do not smoke or let anyone else smoke around the baby. It is a common sense. Always place your baby on his or her back. Dress your baby in sleep clothing and very soft and very easy clothing such as wearable blanket. Do not use a loose blanket and do not overbundle, because loose blankets or over bundling of the blankets may create suffocation for the baby in the middle of the night, because babies keep moving all the time, so they may suffocate themselves with loose blankets or loose clothing. So always place baby on his or her back. Use a firm flat surface. Share your room with the baby. Do not put soft objects, toys, grips. Get regular prenatal care during pregnancy. Avoid smoking. Avoid drinking alcohol. Avoid using marijuana or illegal drugs during pregnancy. Do not smoke. Think about giving your baby a pacifier for naps and nighttime sleep to the risk of SIDS. SIDS is basically sudden infant death syndrome and other related causes of infant death. So it is a very painful condition for the parents, because baby is apparently healthy. When you put the baby to sleep, baby has taken a nap, baby is taken breast milk or formula milk, baby is playful, baby is healthy. You put the baby to sleep, and 2 hours or 3 hours later, when you go to check the baby, and the baby is no more in this world. So sudden infant death syndrome is a very traumatic experience for the parents, and God forbid it shouldn't happen to anyone. Do not get your baby do not let your baby get too hard during sleep. So you do not put extra coverings on the baby for the fear of getting cold. You always Keep checking for the layers, whether you have put uh, whether you have put extra layers or not, because sometimes mothers put extra layers on the baby, and baby's temperature rises very quickly, and it may reach 105 degrees Celsius, 105 degree Fahrenheit within an hour of making the baby sleep. Follow guidance from your healthcare providers. Avoid products that go against safe sleep recommendations. Do not use heart or breathing monitors. Give your babies plenty of tummy time when he or she is awake and someone is watching. So these are very helpful guidelines I found on the internet, and I thought I should share them with you. Then choking prevention is very important. Food and objects that are choking hazards, such as hot dogs, nut chunks of meat, cheese, raw fruits such as peanut chunks, cashew chunks. Then there are almond chunks, hard vegetables, or sticky candies. Yeah, sticky candies as well, popcorns, peanut butter sandwiches, latex balloon. All of these things are choking hazards, and they may cover the larynx of the baby and choke the baby within 5 minutes. And it is very, very dangerous. Choking is very dangerous for the babies. Coins, marbles, pens, or marker caps, small buttons or small batteries, small toys or toy parts, Barbie shoes, Lego pieces, etc. So all of these things are choking hazards. So you should be taking care if there is if there are small toys or small pieces of eating materials within the reach of your baby. The adult should be there to supervise. First of all, you do not give such things to the baby, because they may choke the baby anytime, and we have seen choking babies too many of the times in our clinical practice and in our homes. The babies keep choking every now and then, and miraculously some adult is able to dislodge that choking thing with their little finger or some middle finger or some index finger, and the baby's choking gets relieved. But it is very, very dangerous if the choking thing does not dislodge from the larynx and does not dislodge from the airway, and it may kill the baby within 10 minutes. So you need to take care of the choking hazards, preventing choking. So keep the above foods and objects away from children under 4 years of age. Yeah, that is the very you can say that is the age which is in which the kids are very prone to get choked. But even kids um, uh, mm, of the age of 8 years or 7 years can also can choke themselves. Infants should never have their bottles propped. Insist children eat sitting down. They should not eat while running around. They should never walk, run, or play with food in their mouth, because they breathe harshly, and with that harsh breathing while running, they may inhale the food particles into their airways, and that running may become dangerous. Cut food for infants and children and teach them to chew. Yeah, teaching them to chew is very important. You chew in front of them. That is how you use your teeth. You crush this carrot, you crush this radish, you crush this apple. Yeah, apple peel can also um, choke the baby's tiny airways. So you teach them how to chew. You show them their teeth, and you chew the things, and then you show the carrot pieces blown into small pieces by your teeth, and you show them that's how the kid needs to do with the carrot. So, and you always supervise meal times. You do not give meals to the infants and toddlers and leave them alone. Do not allow elder brothers or sisters who are not themselves adults as well to give the infant or child dangerous foods or objects. Follow age recommendation on toy packages. If a toy package is not below 3 years, you do not give that to a child, because it is a choking hazard. And our last slide for today's lecture is vaccination guideline. So basically, in Pakistan and in many Southeast Asian countries, there are 10 vaccines for vaccine preventable diseases. And these are divided into 6 doses. One dose is given at birth, and the second visit is at 6 weeks, then third visit at 10 weeks, and fourth visit at 14 weeks, and then fifth visit at 9 months, and then sixth visit at 15 months of age. So at birth, BCG is given in the right deltoid for the protection from childhood tuberculosis. Then oral polio vaccine is given in Pakistan and Afghanistan and now in Palestine as well, because due to the re-emergence of polio virus in the children of Gaza, due to the continuous bombardment of Gaza and all of the humanitarian crisis due to the Israel-Palestinian war. So oral polio vaccine is being given in Pakistan, Afghanistan, and Gaza. It is oral polio vaccine. First, zero dose is being given at birth, then hepatitis B vaccine is being given at birth. Then at the second visit, all for oral or OPV1 oral polio vaccine first dose, and pneumococcal first dose, and then rotavirus vaccine is being given. Rotavirus causes diarrhea, life-threatening diarrhea in infants and toddlers. So protection from rotavirus is very important. And then pentavalent vaccine is given. Pentavalent vaccine contains diphtheria, pertussis, tetanus, and meningococcal vaccine and pneumonia vaccine as well. So pentavalent is a vaccine which prevents from five treatable vaccine preventable diseases. So all of these are given at 6 weeks. Then third visit is at 10 weeks, where OPV2 oral polio vaccine 2, pneumococcal 2. So pneumococcal is basically Streptococcus pneumoniae. So Streptococcus pneumoniae is a bacteria which causes life-threatening bronchopneumonia in infants. So yeah, in low-income household settings, Streptococcus pneumonia can cause life-threatening pneumonia and can cause death of the infants. Therefore, pneumococcal vaccine is a routine part of a vaccination schedule in Southeast Asia, including Pakistan. So pneumococcal second dose is given at 10 weeks of age, then rotavirus second dose, then pentavalent second dose, then at fourth visit or at 14 weeks of age, then oral polio vaccine third shot OPV3, pneumococcal third shot pneumococcal 3, and injectable polio vaccine is given at fourth visit, then pentavalent third shot is given. So all of these vaccinations are done at 14th week. Then there is MMR vaccine, measles, mumps, rubella vaccine. Measles first dose is at 9 months and second dose is given at 15 months of age. So this is the vaccination guidelines for our infants, and these are very, very important. And you need to teach all of the parents that these vaccine preventable diseases are very, very important to be protected from. Pneumonia is a life-threatening disease. Meningitis is a life-threatening disease. Even diarrhea is a life-threatening disease in kids. So all of these vaccines need to be given, and these vaccinated kids are protected from these life-threatening but preventable diseases with these vaccinations.
Mm.
Have a nice